mass in anterior supremediastinum was observed in external patient management of anterior diagnosis. Question 25. Which feature would suggest sarcoidosis as the most likely diagnosis of tuberculosis symmetrical higher lymphadenopathy? And the bilateral lymphadenopathy diagnosis are sarcoidosis, tuberculosis, and lymphoma. But bilateral symmetrical higher lymphadenopathy is most likely seen in sarcoidosis compared to tuberculosis. Question 36. Chest pain and fever after an episode of vomiting. Pneumomediastinum is seen in a skin best established the diagnosis. Water soluble contrast swallow. This is actually a child who has chest pain and fever after an episode of vomiting. And on X-ray, there is pneumomediastinum. The skin best established diagnosis is water soluble contrast swallow because he might have esophageal perforation. Barium can cause a severe inflammatory reaction, so it is avoided. When perforation is suspected, we use water soluble contrast swallow. Rhythm 38. Swelling of the face, neck, and arm for 1 week, and patient has tuberculosis. The scan shows an irregular right paratracheal mass with calcification that is compressing the superior cava and right main bronchus with patchy consolidation in the right lung, diagnosis fibrosis meningitis. Okay. This pulmonary embolism, it's a sign symptom, so just remember that it has Western Pollament sign, Western mark sign of pulmonary embolism, and wedge-shaped defect. Okay, now let's confront fibrosis meningitis. We are discussing fibrosis. The patient on CT scan has irregular right paratracheal mass, with calcification that is compressing the superior vena cava and the right main bronchus with patchy consolidation in right lung, Diagnosis fibrosis meningitis. What is fibrosis meningitis? It is rupture of lymph nodes of neck after tuberculosis. After tuberculosis, there is rupture of lymph nodes of the neck is called fibrosis meningitis. Again, let's describe this. This can show irregular right paratracheal mass, which calcifications that is compressing the superior vena cava and right main bronchus with patchy consolidation in the right lung. Diagnosis fibrosis meningitis. Question 39. Chest radiograph shows fine calcification overlying the cardiac silhouette. Okay. Fine calcification overlying the cardiac silhouette adjacent to the right sternal angle. Fine calcification overlying the cardiac silhouette adjacent to the left sternal angle. There is sternum. At the level of the fourth intercostal space, cause rheumatic heart disease or mitral stenosis. Again, rheumatic heart disease. This is chest radiograph shows fine calcification overlying the cardiac silhouette adjacent to the left sternal edge at the level of the fourth intercostal space that can cause rheumatic heart disease or calcified mitral valve. The other signs of mitral valve disease, Walkman sign, prominent left atrial appendage, double right heart border, splitting of the carina, Walkman sign. So diagnosis, mitral stenosis. Next, again mitral stenosis. Fine rim of calcification overlying the cardiac silhouette adjacent to the left sternal angle, sternal edge at the level of fourth intercostal space. If we cross it, divide the heart into 4 chambers, then this will be the tricuspid valve, this will be the pulmonary valve, this will be the aortic valve at the center of the plus sign, and mitral valve be over here. Question number 40, smoke inhalation and fire, likely finding on chest radiograph, pulmonary edema. A patient inhales smoke in a fire, likely finding on chest radiograph, pulmonary edema. Question number 41, history of seizures and low IQ, chest radiograph shows extensive honeycombing throughout both lungs. Chest radiograph shows extensive honeycombing throughout both lungs, which are of normal volume. Diagnosis tuberous sclerosis. Other findings of tuberous sclerosis are calcified cortical tubules, subependymal giant cell tumor, and bilateral angiomyolipomas. And if angiomyolipomas hemorrhage, it causes von der Litt syndrome, and seizures and low IQ, and radiograph has extensive honeycombing toward both lungs, which are of normal volume. Question number 42. Road traffic accident and sustained stress trauma. Chest radiograph shows loss of clarity of the aortic knuckle. Diagnosis aortic rupture. Now, chest radiograph shows widened mediastinum and loss of clarity of aortic knuckle. Diagnosis aortic rupture. See also other images of aortic rupture. Chest radiograph shows widened mediastinum or loss of clarity of the aortic knuckle. diagnosis, aortic rupture, and the CT scan showing hypertonic fluid-like material uh, surrounding the posterior border of the heart, uh, vertebra, and great vessels, and surrounding also the trachea. Diagnosis: aortic rupture, hemorrhage due to aortic rupture. Question number 43. Which feature on HRCT would make allergic bronchopulmonary aspergillosis more likely than astringent allergic alveolitis? Tubular finger-like opacity. Tubular finger-like opacities will make allergic bronchopulmonary aspergillosis as more likely diagnosis than astringent allergic alveolitis. Tubular finger-like opacity. Question 44. A 44-year-old pregnant female has hemoptysis and shortness of breath. Such a graph shows large effusion which is childless diagnosed lymphangiomatosis. The lymphangiomatosis, remember that it is common in females and non-smokers. And Langerhans cell histiocytosis is common in lymphangiomatosis is female plus non-smoker, and Langerhans cell histiocytosis male non-smoker. Similarly, the pregnant female and has chest graph large effusion which is childless, diagnosed lymphangiomatosis. If the option there is Langerhans cell histiocytosis, then she is non-smoker and female, so diagnosed lymphangiomatosis. Question 55. Deep venous thrombosis suspected clinically. Doppler ultrasound shows no thrombus in the thyrocol veins, but is suspected clinically. Spectral Doppler conduced signal with no respiratory variation. For investigation, pelvic ultrasound, because the thrombus might be in the pelvis. A patient has deep venous thrombosis suspected clinically and Doppler ultrasound shows no thrombus in the thyrocol veins. The spectral Doppler shows conduced signal with no respiratory variation. But for investigation, we do pelvic ultrasound. Question 46. No sickle cell disease, chest radiograph shows right-sided lobulated paramedicinal mass in the lower thorax with widening of the rib spaces. Diagnosis extramedullary hematopoiesis. The patient had non-sickle cell disease, and on chest radiograph there are right-sided or bilateral lobulated paramedicinal masses in the lower thorax with widening of the rib spaces. Diagnosis extramedullary hematopoiesis. Again, the chest radiograph patient has bilateral or right-sided lobulated paramedicinal masses in the lower thorax with widening of the rib spaces. Diagnosed extramedullary hematopoiesis. There is also extramedullary hematopoiesis. There is also extramedullary hematopoiesis. Question number 47. Chest radiograph shows ill-defined opacity in the right midzone obscuring the heart border.